Good afternoon, everybody. I think we'll get started. I know that there's a couple other opposing meetings going on in the industry today, as well as it being Health Science Week here in the downtown core of Edmonton and Calgary, that we might not have as many people attending today as we had last month. I want to start off by saying welcome to everybody. If you joined us last month, welcome back again. If you're brand new to our webinars, then welcome to our second installation of the Primary Care Matters Alberta Healthcare Billing Webinars for family doctors. So I'll share my screen with you and we'll jump on in.
All Pacific Health Show.
Okay, can everybody see my screen? Perfect. So today I thought we would go over some basics. We talk about the 03.04A claim, as well as the 03.04A Health Service Code claim. We talk a little bit about the rules that are associated with them, the best practice, if they have any panel payment implications, if you happen not to be on CPAR. And as well as we're going to talk about a few different common claim modifiers that tend to get missed sometimes on different billing codes. Okay, but before we start today, just a little bit of housekeeping items. I just thought I'd bring to everybody's attention the latest Alberta Healthcare Bulletin that came out earlier this week. And it was in regards to problems with H-Link that they had with some submitted claims that were submitted up towards the end of August here. They had some connectivity issues. So there might have been some delays in different payment claims at some of your clinics, or that some of you may have received around that time. So if you notice that your pay was a little lighter from Alberta Healthcare in some of those weeks, this could be why, and it should have been rectified and caught up in the following weeks. Alberta Healthcare Bulletins usually go out monthly. They also have a sign up on their website as well, where you can put in your email and it'll actually notify you whenever a brand new one is posted, which is absolutely amazing for kind of keeping up to date. Especially when something like this happens, when H-Link happens to go down for uptaking the claims. It's always nice to know if for some reason the doctors aren't getting their full pay one week. Okay, so I'm going to jump right in and talk about the 03.04A. For a lot of us that have been in the industry for quite some time, we used to know this as the complete physical code. Which, yes, it is. It is a code that can be used for your annual physicals, but it can be also used in other aspects as well. As long as it's a comprehensive assessment that is examining the different systems, all the systems of the body, with the exception of psychiatry, dermatology, and surgical specialties. Then that code could be used. For example, if you are seeing a patient for the first time that you're doing a complete diabetic assessment, let's say where you're looking at all their body systems, where you're looking at everything that has to do with their health history, where you're doing a complete comprehensive visit, this would be an applicable code that could be used. It is also a code that is combinable with other procedures as well. You will find that if the physician is performing a minor procedure along with this code, as long as they utilize a different diagnostic code. For example, a patient's coming in for their complete physical, but you know what, while they're there, they're also getting some additional wart treatment done on their feet. You could add on the 98.12L, as long as it has a different diagnostic code than the 03.04A does, and both of them then would pay. This code is also qualifies for the complex modifier, which is your CMXC30. And something I want to bring to everybody's attention with this code is this code covers, similar to the Cmgp modifier, covers your pre and post time related to the management of that patient's care. So in essence, the time the doctor is spending prior to the appointment, preparing the patient's chart, reviewing the labs, the charting they're doing after the patient's visit, as well as the time in the patient's visit, is all billable. So rule of thumb, I always like to use when it comes to what I recommend to my doctors when utilizing this modifier in their 03.03A. If you are spending 30 minutes or more with the patient and doing those administrative activities around the patient visit, as long as it's in the same 24-hour period, then I do recommend that they do put on the CMXC 30. A lot of doctors don't realize that it's right as soon as you hit that 30-minute mark, you qualify for this modifier. And it is applicable not just to your 03.04A, but also your first prenatal visits, as well as your complete consultation visits. For example, if you are receiving referrals, you could also use the CMXC 30 on your 03.08A claims as well. Okay, now we're going to talk a little bit about your 03.03A. Now, this is your limited assessment. This family doctors, a majority of the time, probably use their 03.03A quite frequently. It is also a modifier acceptable with the CMGP. And a few things I want to point out about your 03.03A is it is combinable, like we did address at the last webinar, with a bunch of different procedures, for example, removal of sebaceous cysts. But it also falls under the rule as well. If you find you're getting rejections where you are combining your 03.03A with a procedure and it's coming back at a lesser pay rate, it may be because it falls under the rule of that they do need to have the differing diagnostic codes. If you do find you're getting rejections like that, I would recommend checking out on the fee navigator under the additional code that you are trying to use, that you're trying to add on with the 03.03A, just to see if it has rule number, which is at 6.1 attached to it, which is if the physician performs a minor procedure and provides a service warranting a claim for an office visit on the same day, both benefits are payable if the claims and services have differing diagnoses. Okay, your 03.03A is CMGP modifier applicable. Now, this is something I want to spend a little bit of time talking to all of you about, because research that I have done in the last year, talking to different physicians about how familiar they are about everything that the CMGP modifier covers, a lot of them have admitted that they weren't completely up to date on everything that they could claim under this. So I really want to stress to everybody that your CMGP modifier does cover your pre and post work for your patient that your physician is doing. For example, reviewing the patient's charts, writing a referral letter, reviewing results, but not waiting for them. So reviewing on net care, talking with and examining the patient, of course, the time spent in the exam room, as well as the post charting that they do after the charts. Or after visiting with the patient. These are all applicable under the CMGP modifier. And if you notice on the one side of the screen here, you will see the sliding scale of how the CMGP modifier is applied. And that is based on the AMA and the Schedule of Medical Benefits. So it's really good to keep in mind that once you're hitting the 15 to 24-minute range, you are actually already at your CMGP 01 modifier that is applicable on your visit. And to put a little bit of a dollar figure on that, each unit of CMGP is worth $19.19. So it may not seem like a lot if you're underbilling by one unit or if you're missing one here and there, but over the course of the day and the number of patients you're seeing, it really could end up being a loss if you're not incorporating that time that you are doing if you're not incorporating the time for reviewing your chart and the charting afterwards. And as human beings, we don't always tend to look back throughout our day and think of who and when we spent the most time with. I know a lot of physicians have told me that when they're thinking back throughout their day, trying to finish up their billing, they usually add on their CMGP modifier related to a lot of the patients that kind of stuck out in their head that they spend extra time with in the room, or different patients that there was administrative stuff that needed to be taken care of immediately after the visit, and there was a lot of back and forth between the physician and the staff. So I can understand that if If you're seeing 20, 30 patients a day, you might only have 4 or 5 that stand out as being that more complex that you were looking after. But truth be told, you did review the chart for all those patients. You did do your charting for those patients. You reviewed their recent results that came in before seeing them. So you really are applicable for that administrative time to be put on to your CMGP for your base visits. Okay, I want to talk a little bit about here because I've had a lot of questions come in from patients that have not had their panel validated by CPAR. And I'm going to throw a shout out here to all the primary care networks in the province. If you are a member of a primary care network and you are not a member of CPAR, please reach out to one of your quality improvement facilitators or your local primary care network in your area to find out more about that. The best thing to do is to sign up for CPAR and have your panel validated through them. The reason I bring that up is because I've had a few physicians ask questions when they receive their panel payments that come out quarterly. They were a little shocked that they received less on their panel payments than what they assumed they would. They had pulled their panel numbers out of their EMR and were disheartened to find out that actually that wasn't representing what their true number was. So the reason why I bring this up today is I ran into a circumstance with a client of mine that had multiple family physicians that have panels in their clinic, but also had locums that were helping out as they'd had a few physicians leave and had quite a large volume of unattached patients. And what was happening is a majority of the locums were using the 03.04A for their standard visits for the patients. And they were doing this quite frequently. And some of the family physicians had started to notice that they were seeing the physician, that they were billing out for this code more recently than that family physician had because they weren't due for their complex or their complete physical yet for the year. Unfortunately, for a few of the physicians, this did have a problem with lowering their panel number because it was seen happening over and over again. What I do recommend is if you're working on a clinic level and you're finding that your panel number in your EMR doesn't seem to be really jiving with your panel payments, is to maybe have a conversation with your clinic management and your clinic team just on how they reassign the patients. And as well as what their policies and procedures are on a clinic level for utilizing the 03.04A for regular visits. It may be that your management is just not aware that other physicians are actually using this. And it's always good just to have that conversation because sometimes we just don't know what we don't know. But I did want to bring that up in regards to that can have an impact on your panel payments slightly, depending on the setup of the clinic you're working in and how you kind of share the patients, if you're looking after your own panel or if it's kind of gets shared around as well, depending on who the first available physician is that can see the patient. But again, I'm going to do a shout out for CPAR. If you're not signed up, please reach out to your PCNs because that is the #1 best way to have your panel validated and make sure that your patients are being seen by you and not being seen by multiple other locations as well. Okay, I want to talk about some other modifiers that are applicable that I see go missing quite a bit sometimes on some different claims. The BMI one. The body mass index actually is a #1 modifier I see being missed quite a bit. It is a billable modifier for eligible services in any location, including a physician's office, and it has to meet one of these 2 criteria. If it's an adult patient, the body mass index has to be 40 or more. And if the patient is under 18 years of age, they need to be above the 97th percentile for BMI on the approved pediatric growth curve. This, in the same way that you would add your CMGP modifier, there usually is in whichever EMR system you're using, you would see that the BMI is usually in those same drop-down areas related to that. And usually the physicians would be the ones to know best whether or not the procedure is BMI applicable. I would recommend sending out an EMR message to all your team members, just kind of remind them about the BMI modifier because it is one that is generally forgot quite often. Another one is age. Now, this one is a little interesting. As you can see on the screen, there is a quite variety of different ways that age can be modified on different health service claims, depending on the age and the type of visit. Now, our EMR systems are very wonderful when it comes to age. They tend to automatically adjust the bill to reflect the modifier for the age. So this is not something you need to manually enter. But you may have noticed a few times when you're billing out a 03.03A that there's a difference on whether or not the patient is under 65 years of age or they're over 65 years of age. There is a slight pay increase for the age difference. But again, our EMR systems tend to automatically update with the age as in the billing for us. So that's not something that you would need to actually modify yourself. Okay. We will be having our next webinar on October 24th, where we're going to be diving deep into the panel equation and what that means, discussing for panel physicians, how many patients is enough and how many patients is too many. We're going to take a hard look on how a physician can take a look at their schedule and their day to kind of balance out their supply and their demands between what their availabilities are for patients. Because realistically, I've seen physicians have everywhere from 500 patients to some that have 10,000 patients. And I don't think that one physician can look after 10,000 patients by themselves. So I want to be able to give you guys a tool that I have used for many, many years that's helped me to help physicians take a hard look at the amount of patients that they actually can juggle. And we will be taking a deep dive into the panel equation where I will be showing you exactly how to apply it to your practice. And I will also be offering resources from each of the EMR systems, the main EMR systems, and how you can pull the specific reports related to being able to do your panel equation. And I don't want to jinx it yet, but we may have a special guest joining us who is an absolute expert in the panel equation for about the last 25 years. But I'm just waiting to hear back from her. And as soon as I hear back, I'll let you all know for sure if she'll be joining us. So. Okay, and I just wanted to take a couple of minutes here to throw some questions out to the crowd to see if there's any burning questions anybody was having or any issues they're having right now. Since we do have a smaller group today, I thought maybe we could do a bit of a discussion. So please feel free to come off your mic and if you have any questions. Well, okay. So I'm just going to move forward here with the message then from our sponsor, which is the Cmgp calculator. And I'd like to announce to everybody that we're actually looking for 100 family doctors to participate in the 30-day Cmgp calculator challenge, free of charge. There's absolutely no risk to them whatsoever. We give them full access to the platform for 30 days for them to be able to play with the calculator, see if they like the calculator, and to increase their revenue. So there's absolutely no risk to them. More information will be coming out across social media channels as well as through our website starting next week. And we will be following up with some different application forms for any doctors across the province who would like to participate. Okay, and again, if you have any Alberta healthcare questions, or if there is something that you would like to see a whole session being built around, please feel free to send them into info@cmgpcalculator.ca, and we would be more than happy to to incorporate them into our sessions. I will let you know that we have had a lot of questions coming in from long-term care and from ER physicians as well. I myself mostly specialize in primary care billing for family physicians, but I have heard your questions and I have heard your concerns. I've reached out to a few of my contacts in the industry, and in January, we are going to be doing a session where we're going to be bringing in experts from the billing field for emergency room billing as well as long-term care. So please feel free to send in each and every one and any questions you have in regards to those areas to us, so that way I can forward them on to our specialists, and we'll make sure all of them are addressed in our January session. In the meantime, I will also be pulling together some billing experts in some of the other areas, so that way you don't have to wait until January to be able to get those answers that you're looking for, because we all know when it's related to billing, we need to know today. So I will be putting together a list of different billing experts that will be posted up on my website, and I will email them out to all of you as well over the next week, that you'll be able to access, that'll be able to help in different areas related to, for example, emergency room physician, long-term care, ENT, some different specialty areas. Now, yes, because there's just a small group of us here today. That's all we really have for presenting today, and just wanted to really kind of have a discussion a little bit more with our group. Again, there's not as many of us as there was supposed to be. In regards to any limits that you're finding with any of your billing, or any questions you might have right now. If you're having problems with rejections, problems with anything related to billing, feel free. It doesn't have to be on the topic we discussed today. Feel free to turn off your mic and ask the question, or throw it in the chat. Okay, I had one question come into me here privately. It says, how long do we have to send back rejected claims? You normally have 90 days from the time of the visit to submit the claim, and then usually you still have a really good limit on when it's rejected. The clock tends to restart a little bit. If you find that you've had something come in rejected that's still within the 90-day claim, and you resubmit it and you get a rejection, I would put notes on it to the ministry. That tends to help. And I have a 3 rule. Sometimes I've noticed that rejections will come in like that say are outdated, and you can pull the history and see they haven't. I will resubmit them up to 3 times with notes before I actually write them off in the system. Because I do find sometimes, with any computer system, sometimes there is a bit of a glitch. And I do notice sometimes there are rejections that come back that shouldn't be rejected. And once I resubmit them again, they tend to get paid. So I hope that answered what you were looking for. Okay, Michelle?
So you were talking about the 0.3, 0.A, and doctors or locums in the office using that code and possibly affecting panel payments. Now, if a doctor is on CICPAR, does one override the other with that confirmed panel that goes up? So that would kind of eliminate that lower payment because it's a confirmed panel now? Okay,
Yes.
you answered my question.
Yes. That's why I encourage everybody to get signed up for CPAR, because that is the best way that you can know your validated panel number. Because we can all pull numbers out of the EMR, but those numbers can be very inaccurate, especially if we're not taking a deep dive into that panel. Have all those, when's the last time that clinic has or that doctor's cleaned that panel? For example, have you cleared off your patients that you haven't seen in the last 3 years? Have you done a check of all the patients over? My favorite one is, how many patients do you have over the age of 100? If you pull back, no more than maybe 2 or 3, then your panel and your EMR needs a little cleanup, because my favorite was one of the clinics I dealt with when we did a check to see how many patients that they had over 100, and they only had 2, but one was 137 years old. So we kind of knew right there that there hadn't been a little bit of panel cleanup going on for a while. But yes, Michelle, as long as they're registered with CPAR, that has been validated, their panel number, that trumps, and then their payment panel is based on that verified CPAR number. And thank you for that question. Okay, and well, if we don't have any more questions, I won't keep all of you. I'll let you all get back to your lunch because I know how crazy things are in healthcare and we all seem to be going nonstop all day long. So I'll give you back the rest of your lunch hour, and I will be sending out a follow-up email with all the information we covered today, as well as links to all the information as well. And again, please watch out for our website, which I'm going to put in the chat here, because there will be information coming there over the next week in regards to our 30-day challenge and in regards into specialized billing consultants that you'll be able to reach out to in the specialty area that'll be able to help answer some different questions. Okay, so everybody have yourself a wonderful rest of your day, and please sign up for next month's webinar. And if you are planning on attending and you would like to come and work through if you come and would like to work through your panel number with me, please email me ahead of time and we can always set up so that way, and we can do it so it's anonymous. So that way we can set up and work through your panel number with you while we're in the session if you'd like. So everybody have an absolutely wonderful afternoon, and I'll see you next month.